Keratoconus is one of these things that we're seeing more and more of, and I think it's because we have better diagnostics, and I think we're getting more awareness of it. And one of the reasons for the increased awareness is the recently approved cross-linking treatment that we have now for keratoconus. So there's a lot of hope for keratoconus patients. I mean, in general, we've had suitable treatments for patients for years, but nothing really that's been transformative. And we've always been envious of our colleagues overseas who've had this ability to actually make a meaningful change in people's lives with cross-linking, and now we're seeing that here ourselves. And so we've been fortunate here at the Gavin Herbert Eye Institute to be involved in some of the early trials with keratoconus and cross-linking, and since its launch in late 20 or mid 2016, being able to offer it to our patients commercially, and really we found really great results with it, and it really gives patients hope. And because we're able to make a change early on in the disease process for these patients and get their keratoconus to stop, which then precludes the need for some of the more advanced treatments that we have, such as scleral contact lenses. Or now we have a not-for-profit organization that allows us to educate patients on keratoconus and what it means to live with keratoconus and how to treat it, and to not only give patients a resource for doctors here at the Institute, but also outside. So the purpose of the National Keratoconus Foundation is not to promote the Gavin Herbert Eye Institute. It's meant to educate patients on keratoconus, and whether you live in Southern California, or you live in New York, or you live in Boston, or you live in the Midwest, or wherever you live worldwide, we want to be a resource for patients with keratoconus to get patients the information they need so that they can work with their local doctors to individualize their care and get the best care possible. So the right type of patient for cross-linking, again, it's individual. I think that you have to look for a definite diagnosis of keratoconus. We know that keratoconus starts early. I think having the right kind of imaging modality to look at the back side of the cornea as well as the front side of the cornea is important. So if you see those changes early, you really want to get these patients as early as you can before it impacts them that they need to go to these advanced treatments. So a young, healthy patient, over the age of 14, who doesn't have scarring, who's able to tolerate the procedure, sit through it, who has good vision in their glasses or contact lenses or uncorrected, those are really the ideal candidates for this. Other candidates are ones that are in their contact lenses but are noticing a change. Ones that are progressive, people in their early 20s, where they're getting more and more myopic, they're getting more and more astigmatism. But if they're correctable in their glasses or contact lens, those are really the people we can impact and make a huge impact going forward in their lives. And because a lot of these people already have the coping mechanisms to deal with their vision the way it is, but if it continues to get worse, then we start talking about keratoplasty, and keratoplasty brings in a whole host of considerations that are lifelong. Because once you have a graft, in general, this is something that needs to be monitored regularly. There's a chance for the graft to fail, or the graft to reject, the graft to dehiss with any kind of trauma. So if we can avoid all that with a pretty straightforward procedure, that's in the patient's best interest. So if you were to be diagnosed with keratoconus, I think currently in the United States, it's a great time to have the diagnosis, because now we have options that can really transform the spectrum of the disease and halt it where it is. And we've never had that before. Up until recently, all of our treatments were based on trying to deal with some consequence of the disease without actually changing the natural history of the disease. And so with cross-linking now, we can halt the disease for the majority of patients.